getting on to just a little bit about my background, I mentioned some of my affiliations. I started my career actually as a teenager. I was the first organizer hired in Southern California to start certified farmers markets, and was at ground zero of the farmers market movement in California back in the late 70s when Governor Brown was in his first round as governor. And there's now over 8,000 farmers markets, certified markets across the United States. So it's a wonderful legacy to be a part of. And I'm also, as Dr. Harlan mentioned, I'm honored to be part of an international team of doctors in science involved in the metabolic reengineering of food. Next slide, please. So a little bit of context. I find the term syndemic versus pandemic to be a more accurate way of describing what's going on. We clearly had at least one pandemic, metabolic health pandemic prior to COVID-19. And in fact, we are seeing a really high correlation between metabolic health and ability to survive COVID-19. I think at least 3 out of 4 of the leading factors regarding survivability of the COVID-19 virus are related to metabolic status. Metabolic disease is out of control in many countries on Earth, including the Middle Eastern, North Africa region, and specifically in Kuwait, where I'm currently focusing much of my work. Many of these countries don't allow alcohol, and so beverage of choice, for social gatherings and just as a treat, often involve sugary beverages, and processed foods are flooding the Middle East as well as most countries around the planet. The current food system is broken, and we often talk about externalities. Elon Musk recently referred to it as a broken price model, which I appreciate. I think sometimes externalities is maybe sounds a little too abstract, and he's basically saying the price model for our products needs to reflect, go beyond simply the product, but the impact of the product, and both on environmental health as well as human health. We're also seeing, a big shift, I think, in how we look at nutrition science is really not just being a ship floating at sea and go in any direction, but beginning to look at metabolic health and metabolic science as a North Star to guide where it's going. In other words, an outcome focus to guide it. And there is, unfortunately, still little scientific research on the metabolic impact of thousands of food additives and processed foods and how they impact us in our bodies and in our food supply, mixing all up. As another term has been used in this area is exposome science, just beginning to look at multiple complex factors that are affecting our health. You might do a study on any particular substance and it's safe at a certain parts per million or per billion, but we don't really know what the health effect is when you mix all these substances up in our foods and, of course, ultimately in our bodies. Next slide, please. So there is a metabolic paradigm shift afoot, and the company I work for in the Middle East is interested in being a part of this on the industry side. We've seen this shift from just looking at numbers in abstract, as Dr. Lustig said, a calorie is not a calorie. We're beginning to understand body weight in a more nuanced way with using technologies like in-body scans and just coming up with multiple metrics. I, for myself, have learned that I could gain weight in a particular month, actually losing 10 pounds of body fat and gaining weight in muscle mass. And so there's a much more nuanced way of looking at many of these metrics that we've used, and also just not looking at them in abstract, really putting them into context. We've also been focused on, these straw men or sort of false narratives such, defining the problem as being about obesity, as you saw on Dr. Lustig's slide, in the inclusive model of metabolic disease, that it's not just about obesity. The plant versus animal-based narratives, added sugar versus total, just a lot of marketing and manipulation, and all these are swirling around in the conversations around food and health. We have these kind of fake diet wars, the vegans versus the carnivores, the keto folks versus the vegetarian folks, and the list goes on. We're seeing also this major shift from disease care to true health care or prevention, going beyond treating symptoms, but looking to the causes, looking at food as medicine versus simply drugs and devices and procedures, etc. Next slide, please. So this is just another iteration of the slide that Dr. Lustig showed about the inclusive view of obesity and metabolic dysfunction. As he made it clear, there's more people, more thin people suffering from metabolic disease than there are obese people. And so however you want to look at the numbers here, the point is that this isn't just about overweight people. There are many people who are normal weight and who are suffering from metabolic dysfunction. Next slide, please. So we have some of the indicators of the new paradigm shift, the metabolic markers that are emerging, that are very useful, moving beyond obesity and looking at many other biometric markers. Dr. Lustig in some of his other presentations has talked about how we've lowered our expectations and standards in terms of some of these markers to sort of accommodate the mean, but that has really pushed the numbers into an unhealthy range. So there's a bit of redefinition of what a healthy, for example, A1C is, or what a healthy fasting glucose is, etc. We're also seeing this shift to criteria and standards, really understanding the pathways. Dr. Lustig in his previous presentation showed a very elaborate slide on metabolic pathways. This is very complex, and I think we're just beginning to really understand these pathways. We're beginning to focus on key pillars of metabolic health, the gut, the brain, and liver, pancreas. Dentists are paying attention, optometrists, dermatologists. I think a lot of medicine is starting to turn and realize that sort of all paths lead to metabolic health. We're looking at metabolic foods. So, functional foods, ingredients being used to support specific nutritional deficiencies or health conditions, obviously reducing sugar, increasing fiber, looking at insulin response instead of just glucose response, and just shifting to a prevention-based model. And I'll just move on to the next slide. So at KDD, we've initiated what we call a re-engineering initiative versus, food reformulation is something that has been going on in the industry for quite some time. Where basically, the captains of any food or beverage company would tell their staff to go in the back room, come up with a new recipe, use less sugar, or, change the recipe. This is a much more quantified approach. But as it says here, this particular company was inspired by Dr. Lustig's work. And rather than putting him on a hit list, like many big food and beverage companies have, KDD has decided to, let the wolves in the hen house, as they say, and really take a look at some of the evidence and the science around this and see if they can move the dial forward, because there are some really severe nutritional deficiencies and health issues in the Middle East. Next slide, please. So, why this initiative? The food and beverage industry is filled with soothsayers and naysayers, and there's so many narratives swirling around. There's a lot of contrary opinions and skepticism about the processed food narrative and ultra-processed foods. And it's very difficult, I think, for for anyone, whether you're on the consumer side, the industry side, health, medicine, et cetera, to really, sort out these narratives. But we do see that capitalism, is really shifting its focus from being focused solely on, shareholder values and, products and profits to outcomes and sustainability and health. So in essence, KDD is embracing this kind of shift and implemented a really major initiative within the company to go down this path. Next slide, please. So a key focus, rather than just, again, as I mentioned, go in the back room and come up with new recipes, KDD has chosen to develop a metabolic matrix and make this a highly quantified approach versus simply coming up with a new story or a new recipe. And so we're focused on developing a metabolic matrix, which is a scalable and replicable prototype process for shifting the basis of food processing that promotes metabolic health. So, why do we need a matrix? Next slide. Well, as you can see from this image, there's a lot of different kinds of ways that you can approach to designing a food, something as simple as, chocolate milk. Conventional approaches can focus on costs and profits, increasing sugar to make it more sellable, use of a wide range of artificial ingredients, creative, and I'm putting it nicely, labeling and marketing, actually targeting vulnerable populations, list goes on. And then on the right-hand side, various kinds of narratives or, criteria that you can apply to real food. So again, this creating a story around engineering healthy food really requires teasing apart all of these narratives and then really quantifying your approach. Next slide, please. So we've chosen to create a matrix so that we have a really clear and, like I said, quantified approach to re-engineering food. We have the pillars of our matrix, which are feed the gut, protect the liver, and support the brain. And then we break those down into additional details. With gut, with the gut, we focus on fiber, reducing processed carbohydrates, focusing on whole intact foods, prebiotic and probiotic organisms. With the liver, reducing fructose, reducing total sugar intake, increasing hydration, reducing environmental toxins, reducing glycemic load. With brain health, focusing on nutrient-dense foods, healthy fats, and healthy proteins. These are just some of the highlights, so we'll move on to the next slide. Some of the elements of the matrix, the process that we're putting together is one, stakeholder acceptance. Obviously, engaging key interests, both internally and externally, are really important. The commission by whichever company is involved is really important. I think Dr. Lustig mentioned Indra Nooyi's attempt at Pepsi to shift the dial and develop more healthy products, and her shareholders cut her off at the knees, and that initiative was wiped out. There's similar examples in other companies, and so this commission by the leadership is really important in terms of how the internal stakeholders are engaged, and also really to put everything on the table, to no sacred cows, to be sure it's transparent, integrative, that these narratives and dialogues are really shared across the spectrum of stakeholders. Next slide, please. Another element is engaging an independent team of scientists and doctors who aren't simply going to say yes to, just aren't yes men, as they say, yes men or women who are just going to go along with whatever the company wants to do, to get a truly independent team. Precise and science and outcome-based definition of what metabolic health is, and then to really look at the full spectrum of what food is. What is in the food? What are the ingredients? What are the nutrients and components of those ingredients? What has been done to the food, meaning the food processing, and then what is ultimately the metabolic impact of the food, both short-term and long-term. And then finally, bringing together science-based reviews of all the ingredients used. And when you're looking at a larger company, a food and beverage company, there are hundreds, if not thousands of ingredients that might be used. These all need to be evaluated from the perspective of metabolic health. And this is often really deep dive. Next slide, please. Another key element is, as they say, trust but verify. Many of these companies, many companies rely on ingredients and vendors that provide spec sheets, as they call them, that provide some information about the product. There's no standards across the industry for those specifications or the details that are provided. And often, of course, many important details are missing from those spec sheets. And so ultimately, the only way you can really verify what's in these products is to test. And so this is a very expensive and often very elaborate piece of work, but it's an important part of this initiative. The other is just these comprehensive reviews of suppliers, sources, production methods, et cetera. So this is really a comprehensive effort and doesn't just involve nutrition, but also the environmental impact, the quality of ingredients. And for countries like Kuwait in the Middle East, which rely, over 90% of all the ingredients and foods in the country are imported, really verifying the health and safety of these ingredients is quite a complex and challenging task. Next slide, please. Focus in the matrix is on removing, obviously, anything that might be metabolically deranging, obviously to do no harm, focus on functional foods and ingredients, proteins, fats, carbohydrates, micronutrients, phytonutrients, prebiotics, probiotics, targeting nutritional deficiencies. In the Middle East, there are some really profound nutritional deficiencies such as vitamin D. People aren't getting out into the sun as much or covering up due to religious custom. And so there's some really profound nutritional deficiencies that have been identified in the Middle East that need to be addressed perhaps in other ways besides just simply going out in the sun and getting a tan, which might be okay in Northern California, but not in the Kuwaiti desert. There's also some huge disparities in the Middle East between native populations as well as workers brought in from other countries. 80% of the people in Kuwait actually work for the government, which means 80% of the workers in Kuwait come from other countries, and they might be at an entirely different economic level. Next slide, please. Other key elements, obviously, focusing on sugar reduction and replacement. Sounds like maybe an easy thing to do, but the human palate is really accustomed to sweetness. And if you simply remove sugar from a product, which I think we all want to do, a lot of people simply won't buy it because it's not sweet enough. So adjusting products, replacing caloric sweeteners with non-caloric sweeteners, figuring out what are healthy sweeteners versus unhealthy sweeteners, looking at fiber and other analogs, healthy fats, emulsifiers, just a wide range of potential solutions that are emerging. Next slide, please. As I mentioned, this is a highly quantified project, and we're building that on Perfact technology, which, as I mentioned, I'm a founder of. This is a technology 5 years in development, which essentially enables consumers, it's consumer focused and enables consumers to focus on, really what's in the food and to apply very sophisticated criteria and filters towards, products that are out there. So for example, if you want to look for a no added sugar pasta sauce, there's easily dozens and dozens of pasta sauces on the shelf if you go into the average supermarket. How is the average consumer supposed to go through all of those when they are rushing to get home and make a pasta dinner for the family? So and also, as Dr. Lustig mentioned, one of the projects that I've been involved in is the added sugar repository. We've identified 262 names for added sugar, and that's just on the public website. We've actually at Perfact identified nearly 600 names for sugars that are currently being used in the industry. And so when you say reduce added sugar or reduce sugar, we need to be able to quantify that. To be able to quantify sugar, you actually need to know the names of the sugars. And then you need, of course, to know the metabolic impacts, because not all sugars are alike. Next slide, please. So there are many obstacles that we face in initiatives like this. And so KDD is interested in joining forces with other like-minded companies, as well as nonprofit institutions. We've already been partnering with folks at different universities, nonprofit entities, government, healthcare, because no company can do this alone. If simply one company takes some dramatic steps towards reducing sugar or making their products healthy, they could be at a distinct disadvantage in the marketplace. And so, all ships rise with the tide, but they also sink with the tide. And so we have to really think about ways to make these cross-cutting efforts and engaging both internal as well as external partners in these efforts. Next slide, please. One example of this is the Sugar Matrix, which is a project to help us continue to build the knowledge around sugars. When I first started on the journey with Perfact 5 years ago, we thought building a no added sugar filter would be easy. But we found that actually there was no handy dandy list laying around of added sugars. We had to build that. We have a pretty comprehensive list of sugars, but we don't necessarily know all of the processing and ultimately the metabolic impacts of those sugars. And so we've created a construct, a framework where we could gather this information, but it's completely unfunded. And we've been trying to do some citizen science around this and just willy-nilly getting support from, either private citizens or other nonprofits, but it's been challenging. But if we are going to reduce sugar in the food supply, we actually need to know what they are. We need to know their metabolic impacts. So this is a project that's featured on Dr. Lustig's website, as well as on the Hypoglycemia Support Foundation website. Next slide, please. So again, metabolic health is really a highly collaborative effort. We think it's a primary biomarker of nutritional security. We think it's a central organizing principle of food system change. And so how can the food and beverage industry collaborate on the science needed to deploy such an approach? Again, if we just do this as a lone ranger, it simply isn't going to work. In a vacuum or in a silo. We need to begin to join arms with others. So for example, we have the World Health Organization target of reducing added sugars to no more than 10% of calories, or I think that's around 12 teaspoons per day. This has been set as a global level. It may not be low enough from health perspective, but at least it's a global target that's been set. So can countries and regions around the planet adopt that and institute regulatory approaches so that all companies are on a level playing field and no company is at a disadvantage? An example of this is, both Danone and Nestle have had initiatives to reduce sugar in their product portfolios, and both have only been able to reduce sugar across the entire portfolio by 14%. We know that in most countries, we need to reduce by 50%. In Kuwait, we need to reduce by 60% in order to get to the WHO target. So we need to be much more aggressive in these targets, but most companies are reluctant to step out in front because if their product is much less sweeter than other products that are out there, they're at a distinct advantage. Next slide, please. So again, we welcome collaboration, and I'm easy to reach. Please email me. We're looking for partners because as I mentioned briefly, I've been involved in food system change for my entire career. Most of that career I spent marching around. My first thing I actually worked on was the Nestle boycott back in the late 70s or early 80s. And sometimes we have success, but most of the time we don't get let in to the front door. We're not let in behind the scenes, the industry veil, to actually make changes. And I have to admit, if my younger self saw my older self working within the industry, not just shouting at it or watching around carrying signs, my younger self might think I'd lost my my moral compass. But I really believe that it's possible to create change within, especially when you can find companies that are sincerely interested in implementing these changes. But we know we can't do it alone. So please reach out.